Hi, welcome to Centerville Reports Today. I'm Maureen Russell Hodson, and today we're going to talk about Medicare enrollment because the enrollment period starts October 15th and it goes through December 7th. And we know a lot of people have a lot of questions and there's a lot of information to muddle through. Here to help us go through some of that information, we have Catherine Myers, who is the Community Outreach Counselor with SilverLink program, which is part of United Way of Greater Dayton, and Art Wertz, who is a licensed independent Medicare insurance agent with Heartland Insurance. And thank you both for being here.
Thank you for having us.
And it is confusing, this whole thing with Medicare and Medicaid. And so before we even start talking about enrollment, let's talk about, define for us Medicare versus Medicaid.
Okay. Medicare is a program for individuals 65 and over who have been citizens of the U.S. for more than 5 years. It is available to individuals who've, for a period of time, or individuals who may be on disability for more than 2 years.
So 65 years of age, you're eligible for Medicare for the
Correct.
most part. Okay. Mm-hmm. And then Medicaid is?
Medicaid is a limited income benefit to individuals of certain financial situations. That's additional benefits that are available to them.
Okay. And I know it gets confusing. That we're going to talk about Medicare, which would be for folks 65 years of age and older. Mm-hmm. And Art is our expert, but you are actually an independent agent. And so tell us about your background.
My background, I'm an independent agent. We're licensed with a number of the major insurance carriers for Medicare. We're not allied with any one specific company. What that means for our clients is we can look at the individual situation and find the best potential match or matches for them, and then they choose what would be to their most benefit. So
it's not like you're promoting any certain, you're just providing information and you're a resource.
That is correct, and there's no charge for our services.
And no charge. And then Catherine, with SilverLink, you're a great resource for all things for seniors, right?
Right. So with SilverLink, we're part of the information and referral network that's nationwide and specifically Helpline 211 here in this community. And you can call in and with SilverLink, we try to enhance the database for senior serving organizations. So for instance, if you called in asking questions about Medicare, I most likely would, depending on where you live, refer you over to Heartland and Art.
And that way you could ask your questions, because you were saying before we started the program that there's a lot of information that you just can't divulge, right?
I'm limited by what I can broadcast electronic sources, so I have to comply with that. Also, depending on the individual situation, it's specific to their specific needs, and that's why we insist on sitting down and talking with them and finding out what they're looking for and what they're trying to accomplish.
So we don't mean to be cryptic or secretive, but a lot of this really has to be done one-on-one with the client.
That is correct,
right?
yes.
Okay. So when we said that you need to be 65 years of age. So when we talk about this open enrollment period, what does that mean for someone?
Open enrollment period is October the 15th through December the 7th of each year. If they want to change carriers, their insurance carrier with Medicare, they can make a change using an agent or call into the company to change their plan. After that, they are not able to enroll. This is what we call AEP, or annual enrollment period, is that time frame.
So if you choose not to make a change, will you automatically be re-enrolled in the same plan, or is action required no matter what?
No action is required.
No action required.
If you are happy with your plan, you can just stay with your plan. You do not need to take any action.
But if you're interested in investigating maybe some of the other options,
then we can explore those options and would be glad to do that.
Okay. And is that would the best thing to be to make a phone call or to go through SilverLink, or what's the best way?
Well, really, I mean, if you're confused and you don't really know where to go, call SilverLink and we can help direct you there. If you're unsatisfied with your current plan, I would highly recommend that you call Heartland and start that conversation, because they need to be specific. They need to know what your needs are and what you currently have and what changes you're looking to make, and then they can help to direct you a little bit further. Am I on the right track with that?
They are. You don't need to just call Heartland, though. You can call
True.
an independent Medicare insurance agent.
Absolutely.
So,
Okay, so, and we will have a number on the screen as well that you can get some information for. There's a series of phone numbers for assistance, or if you have a question about it. Probably people are so overwhelmed that they probably just stick with what they have, even if they don't like it, but this is just your one chance this year to make a change if you're
That is
interested
correct.
in doing that, right? But a whole variety of plans are
there are a
available.
number of plans depending on what the specific needs or what you're trying to accomplish.
So has everyone on Medicare, will they have received a booklet every year? Do they get this booklet, or do they get something that tells them, hey, you're eligible to change your plan this year?
They usually receive a flyer from Medicare.
Okay.
That open enrollment, you'll hear about it on TV, you'll hear it on radio. You'll see a number of signs out there. But they have a number of options that they can contact if they're looking at possibly making a change or exploring other options. We recommend that what may have been a good plan a couple years ago may not now be the best that's available out there. The market changes.
So it's always good to check, I guess, every year to see if you're getting the best of your benefits,
That is
right?
correct, yes.
And how does it work with other plans, Medicare?
I'm not sure.
Well, with other insurance, is that your only insurance if you have Medicare, or do you have?
Is it the primary, or do they need a secondary?
Yeah. How would that work?
With Medicare, there are two types of main plans. There's Medicare supplements, which you also need a drug plan in conjunction with that,
Okay.
or Medicare Advantage plans. And those usually include a drug plan as part of the plan. You do need to be enrolled in Part A and Part B of Medicare to be eligible for those plans.
So is Medicare something that as you approach 65, you should be checking out and making sure that you're enrolled and that you have all your I's dotted and T's crossed?
Absolutely. If you're aging in and turning 65, we recommend exploring your options involved in that. You want to take a look at what plans are available in your county specific, and determine what you may want, whether a Medicare supplement plan is good for you or a Medicare Advantage plan is good for you. Depending on your situation, you do not need to qualify health-wise for those plans if you're aging in. So.
And it really can be a daunting task, and it sounds like it can get very confusing. So sitting down with somebody who is knowledgeable and experienced is probably the best way to go for everybody approaching 65 or beyond.
That would be my recommendation.
Yeah.
That's just a suggestion.
Yeah, and that's something that you all would recommend to refer people to as well, right?
Absolutely. And we get people calling throughout the year, because
Yeah.
certainly people are going to start aging 65 after December 7th. So,
right.
then at that point, we're like, well, yes, you absolutely need to speak to someone. And whether that's calling the Medicare directly, that number, or Social Security, or an independent broker like Art, then we can refer them out to that, because that's important to start that conversation.
And so I think you're picking up that if you want to start the conversation, calling SilverLink is a great place to start any
It's a great place to start it.
conversation, yeah, for senior services. And we've been seeing these commercials, probably a lot of our viewers have, where people are hiding their Medicare numbers and identity theft. Is this an issue with these cards as well?
It is a concern on the Medicare cards. Part of the Medicare number is the Social Security number, followed by some letters. That will be changed in the next year. The new cards will be issued from Medicare, will not have any of the numbers on that. They'll have different numbers, but that's a different set of numbers. So there's no association between the two. And that's basically to protect the identity theft as well.
But for right now, the card that you have,
Does have,
and you need to be careful with that,
Yes.
right? Okay. And so we've talked about some of the SilverLink services, but just to give people a general idea, I guess you don't have to be any certain age, but you do kind of do an intake when someone calls 211,
Sure.
right?
Sure. So when you call 211, there's two options. So you can go straight through to 211. Any
We should
age.
stop and say it's just literally dialing 211.
It is literally dialing 211.
Yeah.
And you'll get an option to go stay on the line and talk to a CSR, or you can push 3 and that takes you to Silverlink. So once you've done that, when you call in, the person answering is going to start asking you a series of questions. First of all, you don't have to answer any of those questions if you don't want to. The main thing we need is a zip code, and that's how we search to find the right resources for you. But other than that, people call in for a variety of things, from food insecurity to financial assistance to looking for opportunities to volunteer or further their education. So there's all kinds of things that we can help you, direct you to.
It's a free referral resource
It's a free
service.
referral service,
And
yes.
it's also confidential as
Very
well, right?
confidential, yes, absolutely. That's why we do ask some data questions, but you're absolutely free to opt out of those questions at any time. And then once the call is done, the call is gone. So nobody has any opportunity to look back on that call and find out any information you don't want them to know anyway.
And so, Art, if I were referred to give Heartland a call and find out more information, where would you start with me? What kind of information should I have when I make a call to you?
First questions we would ask is, are you presently on Medicare? Do you have Medicare Part A and Part B? Do you have Medicaid? If so, if you do or you don't, it doesn't matter. We'll make adjustments for that. And then if you're looking at making a change, and we can make that change during the annual enrollment period, we'll set up a time. We'll sit down and talk and review your situation. At that point, we'll ask who your doctor is. We'll have to check to make sure that the doctor is in network, because that is county specific, and then also any prescriptions that you might have. And we want to make sure that those are in network so there are no surprises at a later date.
So you're really going to do a lot of legwork for
That is,
someone.
we do a lot of research.
Yeah, so that the person really can feel confident in making the decision.
Yes.
Now, if I turn 65, let's say in January, and do I pick a plan then, and I have that plan until October, or
No.
how does that work?
It starts 3 months prior to your birth month, and 3 months after you can enroll. So you've got a window of 7 months that you can enroll without a penalty in enrolling in a Medicare plan. And I would recommend that you do that as soon as possible, before your birth date, so that
Okay.
because the effective date is the first of the month of your birth date. So.
All right, so that's a good recommendation. Any other recommendations that either one of you would have for people who maybe aren't sure which way to go, other than call 211?
Yeah, I mean, truthfully, if you have a question, there's no question too small. If you're questioning any part of it, pick up the phone.
Yeah.
Because the only way that you're going to feel secure that you've got the right plan is that you've talked to someone. And again, whether it's Medicare themselves or an independent broker, having that conversation to make sure that all of your needs are being met by the plan you choose, it's important to make that call.
And always for resource information, it's good to start with somebody that you feel comfortable with. And we were saying before we started taping that a lot of times as you get older, you feel a little bit of embarrassment,
Right.
Maybe a little bit of fear to ask for help. And starting with 211 is a great place to start, or resources are available and you just have to seek them out.
Right. And with a service like Silverlink or 211, if you have questions about your parents, or you're just not sure that you're in a position to help your parents make the right choice, you can call us and we'll help to guide you as well. We'll ask you the basic same questions, and then we'll refer you to the same sorts of numbers. And we know that sometimes, especially as we're getting older, it's a family decision.
Yeah.
And so it doesn't have to be mom or dad calling us. We can speak to the family and help to guide you to make the right calls and get the right referrals.
All right, well, for more information, again, open enrollment begins October 15th. You can give the City of Centerville a call at 433-7151. Thanks for watching, and we'll see you next time.